cameras so that you're not distracted by our smiling faces. If you lose the little panel that you see here on the screen, if you lose that part, look for a little orange arrow. That's how you get back to that panel if it minimizes automatically. So, yes, health policy and medical research. Is that what we're doing tonight? Yes, and we have some objectives to define what is health policy and why should you care about it? What implications does it have for your own work here at Walden? We would like to help you identify relevant library resources so that you can conduct health policy and medical research without spending hours and hours and hours doing it. We're going to show you this little health policy guide that we have put together that will have links to a lot of the things that we're talking about tonight. I put the URL on the screen. The URL will also be in the PowerPoint that you get, and I bet we can get Taylor to put it in the chat box as well.
I just did that.
All right. I forgot to mention that we do have closed captioning tonight. If you'd like closed captioning, and that address is in the chat box as well. Okay, we're also going to learn effective strategies so that you don't have to spend all of your days and nights finding the research, and we're going to cover some relevant resources outside the library. Government websites can be a great source of information here, and we'll help you do that. So what is health policy? There's a whole lot of different ways to define it, but we are going by the definition from the World Health Organization since we are an international university and people are doing work all over the world. Health policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. So this is going to be interdisciplinary. You will need to look in a variety of places for your research, depending on the subject that you're studying. So if it has something to do with social issues or psychological issues, you'd be PsycInfo. We have a couple of specialty databases for special populations as well. And health policy can be kind of a sticky subject. So we're going to walk you through some of this. How does it happen here in the United States historically? It follows the steps. The bill is introduced to Congress. They present evidence on both sides. They debate. They vote. They vote. They vote. They might have to go back and vote again. If the bill is passed into law, and really that doesn't happen very often, about 4% of bills actually get written into law. The regulatory agencies have to work on the rules and regulations. They can't do that before it gets passed into law, if only 4% actually get there. But then it takes a long time to actually get those rules and regulations down, and then it may be challenged on legal grounds and the Supreme Court might get into it. So that kind of just gives you a timeline, and I pulled up a visual here to show you how it starts with a bill over here and how many steps it has to go through to become law. And that's why this is not such an easy topic to study. But this infographic link will also be in your PowerPoint slides. So why do you care? Because we are part of the Walden community, and Walden provides this community of career professionals, including the staff and the faculty, with the opportunity to transform themselves as scholar practitioners so that you can affect positive social change. And so that is really dovetailing into health policy, because in your research, most of you will become familiar with a current policy on a particular subject, hopefully one that you're really interested in. You can investigate past or ongoing legislative activity on your topic, and you can pull up the evidence. You can pull it all together and have legal precedent and show how laws have changed over the years and maybe in different jurisdictions. And then you can address the grievances, or you can really, cut out a lot of the biases and injustices. And that's what we're really talking about when we're talking about social change, because you can be an advocate for change by your research. Okay. So how do we identify health policy research? We can start with a population affected. It could be a worldwide phenomenon. It could be confined to one country, or right now confined to one country, but has, the potential to become bigger. It could be a region of that particular country, a state, a county, all the way down to a really hyper local municipality kind of issue that may just be in one little neighborhood. So searching for relevant organizations, and by that we mean associations and centers. They may be like a professional association, or it may be a homeowners association. Browse their websites for ideas and really go out there to some of the larger think tanks, and we'll look at gray literature in a minute. But we will also look at the relevant databases in Walden Library. We'll do a sample search in Medline CINAHL, but it works exactly the same way in the other 4 databases that are listed because they're all from the EBSCO company. And so once we teach you one of those, you'll be able to do them all. Okay, some health policy topics, just give you some examples. Access to healthcare, equitable access to healthcare. And healthcare financing can mean a lot of different things. It can mean the changes in the reimbursement rules when the Affordable Care Act came along. It could be the single payer versus regular insurance companies like we have now. There's a whole lot of different ways to define that. Medical research and ethics is kind of a huge thing too, and is becoming more and more research-based. Reproductive health, obesity, and smoking, substance abuse, they're all ongoing public health issues. And so we will look into 1 or 2 of those tonight. So I said something about gray literature, and that is really the publications that are outside of a formal publishing and distribution center. And we're really seeing a lot more of that with self-published information and the last 20 years of internet information. Quite a lot of that can be gray literature. Government information is not peer reviewed, but it is authoritative. It is considered gray literature. There may be a conference that is real particular to your topic. A newsletter of an association like the American Heart Association might put something in a newsletter that points you toward a study in progress. Annual reports, things like that. And then research reports, because not all research gets published. So something like the clinicaltrials.gov has some preliminary research reports from studies they've done that haven't been published in the literature yet. So this also includes theses and dissertations. You may know how to search those here at Walden. We have quite a lot of resources for you there. And more it's becoming blogs, tweets, podcasts. All of this is being added to the great body of information. But for all of this type of thing, for the types of things you're seeing listed on the screen right here, you have to be the person that evaluates them. When we are finding the peer-reviewed scholarly resources in the database, that has been pre-vetted for you. When you are looking at gray literature that may not have even had a formal editing process, then you have to judge where the line is as whether or not this is a reliable resource. And so we're going to help you a little bit with that too. But just know that you don't have to cite everything that you put your eyeballs on. The gray literature may lead you towards more respectable literature sources, but it can be very current because it doesn't take months or years to get out there. Okay. So we're going to do a little exploratory searching. I trust for most people that Wikipedia and Google searching is not a problem, that you are able to find Wikipedia and Google on your own and figure out how to get something out of it. We're going to do a little bit different, things that Google may not find very well, and that is where we go to the library homepage. In case you didn't know, you don't have to go through the portal to get to the library homepage. If you just type in library.waldenu.edu, it'll redirect to this address. And isn't it so much easier to remember library.waldenu.edu, and then bookmark it, put it on your toolbar, and keep it in your head. So our little, our multi-database search, the row here on the front page, searches quite a lot of databases. It does not search all of them by any means. That's just not possible when there's so many different formats, and we have about 150 different databases. But it's good for a preliminary search, like an exploratory search here. And one of those public health topics we were talking about was smoking. So I'm just going to put in smoking here. And that will take us, oops, and you may need to log in. That will take us to a preliminary hit list and the advanced search screen here at the top. I really like working from this screen because it has the 3 search boxes. But before we go there, I'm going to show you this research starter here, cigarette smoking overview. You'll only see research starters like this when you have a big topic, a broad topic, then you don't put in too many words. It'll give you a research starter like this for many medical topics, theories, a whole bunch of different things, and then you can read the background. So this is March 2017. They're not all that new, but it does help to have the history of your topic. And this is a really great way to quickly get a grip on what your research is going to look like, because you have to know the history of it before you can move forward. Okay, so if you see that research starter, by all means, click on it and see if it can lead you to some better things. Then you can scroll down here. This is an ebook that's all about smoking and the health effects. You can scroll down and see what type it is. You can also look at the subject headings under each of these to see if they might be particularly relevant. But we're really looking for that health policy, right? So we were going to go to add policy here, and then I'm going to click search again. And this time, I'm not really going to look at the subject headings as much as the database that it came out of. That one's out of Psych Info. This one is also out of Psych Info, but that's Egypt. We don't really want, oh, and we don't really want Australian. We're just happen to talk about United States today, and it doesn't always work really well, but it can work well if you put United States or U.S. and you don't have to capitalize anything. I just do the or so that we see it, or USA. So that will find any one of those 3 terms, and that can narrow it down so that you don't have to weed through all the different countries, because for some searches, you'll find more literature outside of the United States than you will inside the United States. So this is pretty good. Progress in the 100-Year War against, that is from July 2009. So at this point, you might want to go down and, oh my goodness, this search goes back to 1928. So you might be able to find the primary literature there from that early. But if you want just the last 5 years, you put in 2013, and then you wait for it to update the search. And then you can limit to peer-reviewed scholarly journals if you're at that point. But this is a pretty good point as far as the smoking search goes in the general database. You can see that this is from U.S. News and World Report, and they're not necessarily scholarly topics here, or scholarly journals. If we go back to the library homepage and we select a subject, we can go look at individual database collections for these different subjects. So depending on what it is that you're looking up, you may want to go to psychology or social work, public policy. Taylor's going to talk about that in a little bit, counseling, criminal justice, but we're going to go to health sciences. And then this database search here is like Thoreau, except that it's a more limited list of journals, a limited list of databases that is going to be searched in this gold box. But I'm kind of unsure about that. So I'm going to scroll down to Health Sciences database and try the CINAHL and Medline combined search. If you are searching something that is specific to healthcare, this is not only going to give you a more focused set of answers, you're going to have many more search options here from the get-go. You're not able to get all these search options when you're searching many, many databases at once because they're set up differently. But if you search from the CINAHL and Medline search here, you will be able to go and apply related words. You can limit it to having an abstract, but you can also go down to clinical queries and some journal subsets here. Don't go crazy with these different options, but you can go ahead and put in 2013 here, since we're just working on the last 5 years. You can put in human because they do some experiments on animals, and So different things you can do here with that. And then we will search, and then we'll evaluate the results. That's something that I do almost every time, is I'll put in 1 or 2 words, look at the results, and then I'll put in some more words and look at those results, because you don't want to start off too big too soon. And so this is getting a little bit more focused. So this is a policy change. We don't know yet whether this is, there we go. It's a public policy because it's public housing. You do have to watch for that. So we could put public policy in here, and you could see how that flies, or we could put health policy. We don't want it to return anything that's about the apartment complex policy on whether or not you can smoke on the grounds or something like that, okay? And then we've got these Australians, they're doing a lot of research there. So let's go back and do the United States or US or USA and hit search again. Now remember, we've already limited it to the last 5 years, so don't freak out when you see that you've only got 214 hits. Then if you'd like to add more terms to this search, you can click the plus here and add another row. So if you decide that you're really interested in teenagers, you could say teenagers or adolescents, or, and frequently it will suggest things for you, or adolescents, and then that will narrow your search even further. Okay, so Taylor, did that cover pretty much what we were going to cover here in the
I think
first
it
17
did.
minutes?
Yeah,
Excellent.
that
You
was
want to
great,
take it
Julie.
away?
Sure. Let me
Okay.
share my screen here. Okay. Okay, so thank you, Julie, for that look at some of those subject-specific databases. I'm going to talk a little bit about a couple of legal databases that we have, well, really specifically Nexus Uni, and then we're going to go to a government website to see how we can use government sites as well. But I just wanted to include a bit more information before we do that. Julie mentioned the policy by which a bill becomes a law previously, and I just wanted to follow that up with a few different kinds of laws or policies that you're going to encounter as you go about your research. So there's 3 kinds of laws. There is statutory law, and those are laws that emerge from a legislative body. So the US Congress being one of them, or a state Congress, or a town council. And then there's case law, and that comes out of those court opinions, and that comes issues from the judicial branch. And then finally, the executive branch of government, those bodies issue the regulations that constitute regulatory law. So you might be looking for one or more of those types of policies, depending on your needs. Another thing to be aware of before you get started researching policy is that there are a lot of different terminology. There's a lot of different terms used when we're talking about policy. So within the legal world, laws are rarely referred to as such. They're most often statutes or regulations or court opinions, among other things. You might also see bills, public laws, private laws, etc. So, and to make matters worse, not that they're particularly bad, but they're also ascribed seemingly unintelligible citations. So they can be very confusing. So don't feel bad if you see a citation for a policy and you have no idea how to interpret it. But if you do have that citation, you can use that to search, which we'll talk about in a moment. So I'm just going to, couple more notes here. So at the federal level in the United States, all statutes, so those are things emerging from Congress, they will eventually be published in something called the US Code. Regulations, on the other hand, end up in the Code of Federal Regulations, and all case law ends up in the US court opinions. So that's just where these different kinds of laws are published. Now, for individual state information, you can use this link that I posted in this slide. That's going to help you determine where policies are published in your particular state. on this slide, I've just listed out a whole lot of places that we can go to look for policies, and we're going to see a couple of these in a moment. But if you wanted to come back and explore some of these other ones after the presentation, be my guest. There's actually a lot more government websites that I could have listed for health policy, and a lot of those are going to be located in that health policy guide that I linked in the chat box. And here on this slide, just some additional web resources. So how do we search for legal materials? Three main ways. One, by citation. If you do happen to have that citation, that's great, and you can use that. And I just wanted to follow up something that Julie mentioned at the beginning about Wikipedia. Even though Wikipedia is not going to be a good scholarly source that you're going to cite in your research, one of the best things about Wikipedia is that it will give you the citations for specific policies. So you could do some exploratory research on Wikipedia and get the citation of a specific policy, and then come to some of these databases and search for more authoritative information about that policy. So keep that in mind. Another way you might search is by common or popular name, like the Freedom of Information Act. And then finally, you can browse by topic, which is probably what you'll be doing in the initial stages of your research. So I'm going to pop over here to Nexus Uni, and just a little bit about Nexus Uni. Nexus Uni is it's a database for legal and business information. It's going to provide you access to all three kinds of laws that we've talked about: statutory, regulatory, and case law, as well as a whole bunch of other stuff. So law reviews and journals, case notes and briefs, news articles, and much more. So the other thing about Nexus Uni is there are a lot of ways to search. You see this big search box on the home page here. I have another webinar that's in our webinar archive that goes into much more detail about Nexus Uni and how you can search. So feel free to check that out if you want some more information. But we're just going to use this main search bar today, and we're going to leave it set to all Nexus Uni over here. Although you can change this to tell it exactly how you want it to search. Okay. So I'm just going to do a quick search for a broad health policy topic like obesity. Now, I typed obesity in, and you can see that it auto-populates some recommended documents and legal phrases below as you type that in. We're gonna talk about that in just a second, but for now, I'm just going to go ahead and search. And when you do a search in the main search bar of Nexus Uni, it's going to default to show you the news category for these results. So you can see over here all the different categories. We're showing the news articles right here. So that may be what you want. It may not be. If you're looking for official policies, you're going to need to select a different category. So let's go to statutes and legislation over here. And so you can see we still have over 10,000 results here. I'm going to go down over here on the left-hand side, and I'm going to limit to a specific state under jurisdiction. I'm going to go to Georgia. And so this is what one of your results lists might look like. Now, as you can see, all of your results are going to have these confusing citations as their titles. But don't be afraid. You can usually tell where this is coming from by looking at the information under each of those titles. You can look at the table of contents down here. If you go into one of them, you'll be able to, you see this big button in the middle of the document that says copy citation. That can be really helpful because as I mentioned, legal citations can be a little bit confusing. So you can simply click on that, copy that citation, paste it wherever you need it to be. And you can also see right down here that you have the hyperlinked parts of the Georgia code where this particular policy appears. Up here in the search document box, you can search within this document for any other terms that you're interested in. So let's say, for example, you were interested in childhood obesity. So we'll see an example of how you could do that, but you could search for child up here or children, and you would see everywhere in this document where children are mentioned. And then finally, this go-to box is also helpful. This is acts as an easy way to navigate within this document. And you can go all the way to the bottom here and look at the annotations and the notes and the commentary. And a lot of times you'll see references. And that's how you can follow additional leads to get to other policies or other pieces of information that have gone into the formation of this policy. All right, so I'm going to go back now, and when I do, back to our list of results, when I do, I see this eyeglass icon over here. That tells me that I've seen this document already, and that can be helpful because a lot of these things look very similar. And
Taylor,
sure.
Before you go on, can you make one distinction for us? We have a student asking, is policy the same as law?
Policy is the same as law, yes. Although those two individual words might be used differently in particular context, the general meaning and understanding, the way we all use those terms, is the same. Yes.
Thank you.
So back on this results page, another thing that you can do is, let's see. Here we go. Over here on the left, you have this option to search within your results. So again, this can be helpful. And I'm going to go ahead and run a search now for children or childhood. But I'm going to do that by cutting off the end of those words and replacing it with an asterisk. This is called a truncated search. And you use this when you're using a word that could have many different variations, and you're really interested in seeing any and all of them. So in this case, this search is going to return results for child, children, or childhood. So I'm going to go ahead and do that. So we started with 342. Now this drops us down to 194. Okay, let's pop back over to the home page, and I just wanted to show you those recommendations that Nexus Uni makes as you search. So you first have documents, and a lot of times you'll see these ones that say article, colon, and then the title. Anything that says article like that, that's going to be coming from a law review or legal journal. But then you can scroll below that and you start seeing names of individual policies. So here we have the California Childhood Obesity Prevention Act. Under that, the Georgia Morbid Obesity Anti-Discrimination Act, et cetera, et cetera. So definitely take a look at these recommended terms and documents because they might be really helpful to you. All right. Now, the last thing I will say about and if you do end up searching for a specific policy by name, so the California Childhood Obesity Prevention Act, for example, you can search for that right up in this main search bar, but just make sure that you put that phrase in quotation marks. And that is going to hold true for any phrase that you search for in our databases. Those quotation marks are going to tell the database that you're interested in seeing results for that exact phrase, as opposed to all of the individual words that go into that phrase. If you come back to Nexus Uni after this presentation and are running some searches and get confused, have some questions, they really do have some really great instructional content that you can access. One way is to click over here on this help link, and another way is to click down here on tips. Both of these links are going to be really, really helpful for you as you're working on your own. And another way to search down here is this guided search, which is pretty self-explanatory. So you might give that a try as well. So that's Nexus Uni as a very basic search. And now we're going to hop over to FedSys. FedSys is the largest online provider of government documents. It is a .gov website, so you can see up here, gpo.gov. And so you know just by that suffix .gov that it is a trusted source of information. it's going to cover all three branches of government, including statutes, regulation, and court opinions. Similar to Nexus Uni, it has a lot of really good instructional content, and you can access a lot of that via these links over here to the left. Alternatively, you could use these links to the right under Browse to browse different resource types, different kinds of information that you can access in FedSys. So for example, we could click on United States Code down here, and then you would be able to select a year, a title, a chapter, etc. However, if you do that, it really is just for browsing. You're not going to be able to use search terms. But we want to use search terms, so I'm going to go ahead and type obesity into this main search bar in the middle of the page. You can see it's much less conspicuous than the one in Nexus Uni. I'm going to click search. And so we are getting over 24,000 results when we do this. So we're going to want to narrow this down. And again, your limiters are going to be located over here to the left. For today's demo, we're going to limit this to, let's limit to statutes. Let's see. Actually, let's do Code of Federal Regulations, or the CFR. Now, again, these are where all national regulations are going to be published. So that drops us all the way down to 39 results. You have, let's see, I'm going to add a term to this search. So you see up here at the top, your term is in this search box, but you also have this option that says within results. So I'm going to check that, and this is how we search within these results, just like we did in Nexus Uni. So I'm going to do child with an asterisk again, and this is going to leave us with 16 results. So from this point, you can simply click on one of your results. This is going to take you straight in to the document, and it's going to be in PDF form. Some of these can get quite lengthy. This one is not. It's only 2 pages. But for the longer ones, you can hit Control F on your keyboard, and that's going to allow you to search within the document for any terms that you want. Okay, let's go back now, or close this out. And let's see. What else did I want to show?
You're going to do some CDC statistics by topic as well.
I was gonna show one of the, oh, here we go. I'm sorry. If you click on more information, this gives you a little bit, some additional information about the document you're viewing up here. But then there's this part that's really helpful, document in context. You can see where this part of the Georgia Code, I'm sorry, this is the Code of Federal Regulations, where the policy you have access fits into the entire code. So you can do that, and then you can scroll through and see all of the various other parts of the CFR that might be relevant to you. So for example, for health policy, Title 42 is public health. Title 45 is public welfare. So you can just go ahead and explore those areas as you wish. Now, another thing that you can do at FedSys is access those CRS reports. And I don't think we mentioned those at the beginning, actually. I meant to. Let's go back here to FedSys. CRS reports are a great place to do some exploratory searching or look for background information on your topic. And CRS means Congressional Research Service reports. And I'm actually going to pop back over here to, where were those? Sorry about this. here we go. These are reports that are produced for Congress by individual committees. So they function essentially as a nonpartisan legislative branch housed in the Library of Congress. And they do research on all these various topics when Congress is considering a particular piece of legislation. So they're really good for background information. They're often really good for statistics as well that relate to enacted public laws as well as to proposed legislation. And the ones that I've hyperlinked in this slide are particularly good for health policy. So the way they work is they are accessible in FedSys, and I'll show you that in a moment, but it only goes back to 1995. So if for some reason you were interested in CRS reports from prior to 1995, these sites that are on this slide are going to be a good place to look for those. Now in FedSys, you can access those congressional reports over here on the right where it says congressional reports. But again, that's only going to let you browse. So what you could do alternatively is do a search like we did before, and then over here in the collection, you could limit to congressional reports. And this is how you would access those Congressional Research Service reports. All right. Now for statistics, as Julie mentioned, we have some resources for you as well. One of the most helpful resources is probably going to be this combined statistics search, which is located in the health policy guide that I linked in the chat box. So this is the guide, and if you scroll down here to search tips, we have a box for statistics. It's not here. Is it in databases? Julie, do you remember where we put that?
I usually just search.
There we go.
I usually search for it. So.
Oh, you can certainly do that too, but it is in this guide. If you go to government websites, we have this box that says statistics, and here you have this option for statistics combined search. So if you click on this, it'll give you this search box, and you can type in any topic you're interested in, obesity, for example, and it's going to return results from a whole range. It searches hundreds of different government sites, and it's going to return results for any sites that have statistics related to smoking or obesity, I'm sorry. So that's a really good resource to know about. Also, this database that we have, Sage Stats, is going to be good. The Center for Disease Control has a lot of data, and they have a statistics by topic site. Data.cdc.gov is a very similar site. And finally, the US Census Bureau has a feature called American Fact Finder, which is a pretty user-friendly way to access statistics. So that concludes what I wanted to cover, Julie. I think we're getting close to our conclusion here. I did want to show you how you would access additional webinars. So we have a webinar archive, and you can access that from the library's homepage by clicking on down here on Library Skills. And then in this central box here, this is where our webinars are. So we have a link for upcoming webinars and recorded webinars, and you can go about, you can search by topic, or you can search for general library skills. Also wanted to show you how to contact us if you have any questions about anything we discussed in this session today or anything in general. You can contact us using this Ask a Librarian button in the top right corner of our website. When you click on that, you're going to see these various options for contacting us. You can email us, you can chat us during specific times. It lists out the time for each day. You can also call a question in. And if you are a doctoral student, you have the opportunity to schedule a research appointment with one of our liaison librarians. Now, normally you would be meeting with the liaison for your particular subject area, but a lot of times your topic will be multidisciplinary. So you might want to meet, you might be a nursing student, but you might want to meet with the psychology librarian. So that is an option you have if you are a doctoral student. Let's see, library guides and quick answers are the last thing, and this is a really good thing to know about in terms of searching the library site in general. Julie showed us earlier how to use this main search bar to search Thoreau, but you can switch this to search everything, and that's how you're going to access our library skills guides and our quick answers. So for example, if we had a question about peer review, for example, simply type that in. Our guides are going to appear in this first column over here. And you can see all the various guides and sections of guides that we have on peer review. And then in the central column, you're going to see quick answers. And these are just really concise answers to commonly asked questions. And they are going to link out to related information at the bottom. So really, really helpful. Whenever we as librarians have questions, this is where we come. So if that is a testament to their utility. But that's it for me. Julie, do you have anything else?
I think that's good. That is what how I usually get to the statistics combined search, is putting it in that search box. So I would encourage you to try that if you're stuck on something or you don't remember where something is on the library website. I'm going to go ahead and stop the recording at this point and see if any